Welcome to Southland Integrated Services. My name is Dr. Thuyen Nguyen. I'm a family physician here at Southland Integrated Services. Today's topic, we want to talk to you about diabetes, and as you know, is a very important chronic disease. Our providers will talk to you more about the diabetes.
Yes, so in diabetes, the body normally brings in sugar from what you eat to be used as fuel. And the body uses insulin from the pancreas to bring in sugar into the body tissues to be used as energy. However, when you have diabetes, the body's insulin doesn't work as well or doesn't work at all. So the body isn't able to bring sugar into the tissue. That sugar stays in the bloodstream, and thus your blood sugar is higher than it normally is. When your blood sugar is normally higher than it should be, that causes body changes and can affect various organs and can lead to diabetes. The symptoms of diabetes can include increased thirst, increased hunger, increased urination, feeling more tired than usual, infections that come on more often than usual, and wounds and infections that take longer to heal. Later symptoms of diabetes can include numbness and tingling in your extremities, and sometimes sores in your feet that take longer to heal, as well as vision changes such as more blurry vision than usual. Great question. So, in regards to diabetes, you might have symptoms of diabetes, but you might not. So, if you have symptoms of diabetes, these could include increased thirst, increased hunger, increased urination, or sometimes you'll feel generalized fatigue, feeling tired all the time. You could also have longer time to heal and increase infections like yeast infections or upper respiratory infections. If you have these symptoms, it's good to go see your primary care provider and get a blood test and urine test. With the blood test, there's a test called a hemoglobin A1C, and this can be done in the clinic or the lab. This checks the amount of sugar that sticks to the red blood cell. And normally, if you don't have diabetes, this number is less than 5.7. If you're pre-diabetic, this number is 5.7 up to 6.4. And diabetes is diagnosed when your hemoglobin A1C is 6.5 or higher on 2 occasions. Or you can also do a fasting blood sugar, in which case your sugar will be 126 and higher on 2 occasions. A patient who is newly diagnosed with diabetes will most likely fall with their primary care provider, and what we would do as providers is counsel the patient on lifestyle modifications, including diet changes, a low carbohydrate diet, and regular routine exercise. We recommend tobacco cessation, weight management, and there are certain medications that we could recommend, such as taking cholesterol-lowering medications and a baby aspirin to help prevent stroke and heart attack. In regards to treatment of diabetes, that is based on how high your sugar is and the patient's individual demographic. So we could start medications, but at the very minimum, we would most likely start with lifestyle modifications. Diabetes is a manageable disease such as high blood pressure and high cholesterol, and patients can live long, happy, fulfilling, vibrant lives with a diagnosis of diabetes thanks to modern medicine and the technologies available today.
So there are a couple of ways you can do to lower your blood sugars. Number one is lifestyle changes. You can exercise every day for 30 minutes. Also cut down on your fat and sugary food. Lose weight also very helpful. You can see a provider to kind of give you an idea of how much weight you should be at. And the last thing is medication. Very important that you stick to your medication regimens. Any side effects or question, you are welcome to come to see our providers, and we will help you with overcome the side effect. There's no specific diet for diabetes. However, I do recommend food that low in carbohydrate. Having diabetes doesn't mean that you have to stop eating the food that you love. Just don't overeat them and causing the sugar to be so high.
So patients with diabetes oftentimes will start with lifestyle modifications, diet and exercise. And if we need to, we can start them on oral medications such as metformin or Amaryl or one of the newer diabetes medications. Injections are generally reserved for patients who have very uncontrolled diabetes, pregnant patients, or any patient where we really need to get their blood sugar decreased and controlled right away to prevent complications. So it's not absolutely necessary that a patient needs to inject insulin once they are newly diagnosed with diabetes. There are other ways to treat your type 2 diabetes before using insulin shots. However, if a patient does need an insulin shot, we will counsel and instruct and educate them on the proper use of insulin shots. There are types of insulin shots that only need to be injected less frequently, for example, once a week as opposed to daily or multiple times per day.
If your diabetes is not treated, there are many complications such as stroke, heart attack, renal failures, blindness, foot infections that can lead to eventually amputations.
In regards to diabetes, especially type 2 diabetes, there are certain things a patient can do in regards to lifestyle modifications that can prevent or reduce your chance of developing diabetes. These include diets, a low carbohydrate diet, and routine regular exercise. Keeping your weight steady and avoiding increases in weight can also help. There have also been studies that a whole food plant-based diet can also prevent and control type 2 diabetes.
Diabetes is a very challenging disease, but we have a lot of good medicines. We have a very good team here. So if you need questions, we are here for you, and we're very happy to assist you to manage your diabetes.